think we are live and we are going.
Yes.
It had a minute of a glitch there, so I was a little nervous, but we are here. Welcome to the Right Physical Therapy Show. We are super happy to be here. I am Dr. Kate Anderson. This is Dr. Alex White. We are thrilled to be here to talk to you about the treatment of concussions today. But first, we have a very important guest, and so we're going to bring on Rebecca, who is here. Miss Rebecca Price. Come on in. There's the flair. We asked her to come on with some flair. Could you please share with us kind of the current happenings going on in Right Physical Therapy? That would be important for us to know.
Absolutely. The Best of Greater Idaho Falls voting is open, and we are proudly nominated in 2 categories, Best in Physical Rehabilitation and Best in Customer Service.
Awesome.
So if you want to show some support, go online to their website and vote for us. And I've looked, and you can vote 10 times a day. So
oh my goodness.
I'm game for that.
So a minimum of 10 times a day.
Yes. We'll just put
a
it on
minimum and a maximum of 10 would be great.
Also, we are running a promo right now for 4 dynamic movement assessments. This is the first time we've done this promotion. Normally $180 value, and we're doing half off, so $90, and that is running through 7/23, so July 23rd. That will end, so you can get in and make an appointment for that. Go online, call one of our clinics, and get yourself scheduled for that.
Okay, perfect. Alex, those dynamic movement assessments, let's actually talk about that for a second. Thank you, Rebecca.
Awesome.
That was
Thank
beautiful. Because that is actually a great deal. Maybe talk about what we do in the dynamic movement assessment so we can kind of talk about the value that comes with that.
Yeah, and I think not many people have heard of a dynamic movement assessment, but more people have heard of, say, like a physical, where before you are allowed to participate in sports that season, you have to get evaluated, make sure all the joints move correctly, make sure you have normal reflexes, make sure you're healthy. And basically, this is a dynamic physical. This is an assessment of both the arms and the legs to see how things are moving, what your movement pattern is like, as well as if there's any areas of irritation, so that way you can proactively address them prior to an injury. So this can be something that some people have heard of as prehab. Basically, this assessment tells you what are some areas that are maybe lacking strength or mobility that you can address proactively to help with prevent a recovery or prevent an injury, but also possibly mitigate something from becoming worse. And so very tremendous value. We do a lot of these with sports teams in general, but we do want to open it up to the general public. I think everybody is an athlete to some degree, and so definitely taking advantage of that would be highly considered.
Yeah, so just a much more complex physical, basically, looking at the musculoskeletal system, so how you move. The movement patterns when you're doing physical activity is important because they can cause strain, they can cause injury, right? And so it's not just our high school athletes. We tend to see a lot more high school athletes doing this and some of our college athletes. But I mean, if you decide, hey, I want to do a half marathon this year, that would be a great thing to do, to come in and say, hey, before I start this training, which is rough, right? Let me do this, right? Like whatever it may be.
Speaking from experience,
right? That half marathon about killed me. It was fun, but it about killed me.
Yeah.
No, and in all reality, it was fun. There was nothing that about killed me. But the fact that I could understand my movement patterns and I could make adjustments is what helped me get through that. And so really anything that if you're starting a new activity, those dynamic movement assessments, or as we call them DMAs, they provide a lot of value, and that's a great promo that we're running right now. So anybody in that situation, please contact us. So with that being said,
sorry, I'll pause for a second. We are going to get subtitles on here after the video gets posted. We're going to work on that. I just saw a little comment. Sorry to interrupt.
No, that's totally fine. So with that being said, we are very excited to talk today about concussions. So this is part 2 of a 2-part series, right? Last week we talked about how to know if you have a concussion, right? Yeah. So the assessment of it, the evaluation, that was awesome. We had a lot of great questions about that. Today we want to talk about the actual treatment of the concussion. And so we are here as both people that have treated concussions, but also people that have had concussions, right? We've had our bell rung a few times, right? Between the 2 of us. Sometimes we ring each other's bells every once in a while, start throwing hands, different things like that. So we can talk about it from both sides, which is nice, right? And so the main thing we want to get across with concussions and the treatment of concussions is that neural tissue, which is basically what I mean by that, that's the tissue that makes up brains, nerves, right? Like brains, plural. We actually only have one brain.
That was the hand thing Tyler did last week. So if you want to be entertained, go back to that one.
Yeah, exactly, right? Like it's the cellular tissue that makes up the tissue that is in the brain and the nerves, right? And so neural tissue, it's different than muscular tissue, than other types of tissue, right? It's much more complex, actually. So there's things called gray matter and white matter. There's myelination, which allows communication to move through it. There's a cellular matrix that is a completely different makeup than regular tissue that we typically think of when we think of tissue within the body. And so because of that, it's the healing of it is also more complex, right? It doesn't heal in the way that regular muscular tissue does. It's a completely different system for it, right? And so we know, right? You get a tendinosis problem. The issue there is that you've got a damaged tendon. You need to increase blood flow to it. You need to increase inflammation to it initially, because that will actually help the body to heal that tissue. Well, guess what? That does not work with neural tissue. It's completely different. And so we often think about trying to increase blood flow to tissue to improve the healing of that. But when it comes to neural tissue, blood flow can actually become damaging to it. And so blood flow can actually increase pressure into that. And so you don't want to do that. You don't want to overdo things when you have healing tissue. The key here with all healing tissue, the one thing that is common no matter the type of tissue is that optimal load is what is needed to help progress back to normal activity. We've talked a lot about optimal load. It's super important when you have a concussion that you have an optimal load bringing you back to normal activity. However, it is different and it is complex, and that is why not just anybody can treat a concussion, honestly. So just because you're a physical therapist or just because you're an athletic trainer doesn't mean necessarily that you're great at treating concussions, honestly. And I hope I don't offend anybody by that. But it's complex. It takes a lot of advanced training, and it also takes a really perfect understanding that everybody is different. And so there is no cookie cutter approach to getting somebody back to normal activity after a concussion. It really is a very complex system, and that's what we want to talk about today, so that we have a better understanding of how we can do that. And so Alex, give us an idea of how that looks when we get somebody into our office, they've had a concussion, and now it's time to get them back. What does that look like?
Yeah, and I just want to dive in real quick and say it's not only that you experience or that the practitioner has training, it's that they're consistent with their training too. A lot of practitioners will notice in any field that once you're out of school 3 to 5 years, a lot of the things that you were initially taught may actually be substandard. And I say substandard meaning that you may not necessarily be hurting people, but you may be slowing down their recovery. And so something to just really be confident in is you can have confidence in your provider if they're developing their skills that way. And so like Kate said, just because you have initials after your name doesn't make you an expert. I think the proof is in the pudding is something I'll sometimes say with patients is like, don't just take my word for it. Let's see what we can do about it. And so going back to treating a concussion, one of the most cardinal symptoms of a concussion being provoked is headache. It's not the only one. So there can be dizziness. There can even be basically like sharp pains with light. There can also be like neck pains. There can be different sort of referrals. And the biggest thing that Kate hit on there is that every concussion is different and every person's different, that we need to treat them appropriately.
I think it's interesting. We just got a comment from Sarah. Hi, Sarah. Love you. It's good to see you.
Yeah.
She actually said she's had multiple concussions, and her recovery was different on every concussion.
Yeah,
So,
and very common
exactly.
actually, is that each area of the brain, although they talk to each other, each area of the brain has a primary function that is different than other parts of the brain. For instance, back of the head, kind of basically through that occipital lobe, there can be more visual issues. With that proximity to the neck, you can also see a lot of strain symptoms in the neck. Getting hit more in the front of the head, you can have some harder time with reasoning or critical thinking. Everybody's are going to be a little different, and that's going back to last week, how the evaluation has to be thorough. And it has to start slow and lower intensity, so that way we can build up intensity. And I think that's what we want to jump into now. Is treatment is very similar. Is you basically go through graded exposure. Kate said optimal load, and I would say if we want to be known for anything at Right PT, is that we're the best at that. Is we're the best at optimally loading people. Optimally means no better than that. Is that when we load our concussion or we load an exercise, we want to make sure it's the best way we can approach it. And so the way we do that is through process of elimination. We start with the lowest hanging fruit, you could say, of some of these things. So I think all the athletes are wondering, how long till I can get back? The thing is we always talk about return to play, but we never talk about return to learn. So we talked last week, I think Tyler made a grandma joke. I don't remember it. It wasn't very...
It was really offensive.
Really offensive, probably, because it's Tyler. But
it was not. It was.
So that low sensation lifestyle, like the lights are low, you're hanging out, maybe you're reading a book, maybe you're, you're going to bed early, you're waking up in a reasonable time. But we're getting back into this return to learn, so you need to get back to having a normal day. So if a normal day is going to school, you need to be able to go to school without getting a headache. This is before we ever talk about returning to practice. So then we're talking about, and this is all coming into therapy with not only exercises, but how we're exposing that person to their rehab. And so getting to this return to learn. Can I go to school for a whole day? Can I go to work for a whole day? Can I complete all of my job duties before we start thinking about that half marathon? Before we start thinking about that, football, running into another person at full speed. There's graded exposure, and there's basically a checklist of once you get to this level, then we attempt the next level. So for instance, from a sport perspective, you'd go from light aerobic activity like jogging into some sport specific exercises for your sport. That'll vary. So, football, we are going to do probably, if you're a wide receiver, you're going to catch the ball, you're going to run some routes, you're going to do those things. No one else is touching you. It's a controlled environment. But if you get a headache in that version, or I guess that level, or that stage, I should say, you have to go back. You have to go back to the stage that basically didn't cause symptoms. And I think this is where we talk about like non-contact drills going into contact drills. The big point being is you have to return to practice before you can go to a game. Everybody uses the NFL for some example, and unfortunately that is not a great example for all of us armchair quarterbacks like I am.
Yes.
But that really, they always talk about this, they're at this stage of the protocol. And the point being is that the protocol is there for a reason, but you have to graduate through it. It's not a matter of getting to this stage and then, oh yeah, I can go full speed now. You have to go through that graduated approach, so that way you can be sure, and I think we're going to summarize it in that way, that you did it right the first time. And I always feel punny when I say do it right.
Yeah, do it right, pun intended. Yeah, that's a good one. I really like that. No, it's so true. If there's one thing that drives me a little crazy, besides Alex, no, I'm just kidding. If there's one thing that I struggle with, it's that one of the most common questions we get after any injury is, how long am I out, right? ACLs happen, for example, you get surgery, they want to know, when can I get back? When can I get back? And a very common response to an ACL is like, oh, it takes 6 months. The reason why they say that is because Adrian Peterson did it once, one of the greatest athletes in the history of mankind, right? He came back 6 months after surgery and he won the MVP. Well, guess what? He's a freak. And everything went really well, in a good way.
Yeah.
Adrian, if you're watching, Adrian, love you.
Freak's a compliment.
Freak is a compliment, right? Everything went perfectly well for him, and he's an advanced human being to us physically, right? The same thing goes with concussions, though, right? Like, so often you want to hear, ooh, I've got a concussion. When can I get back, right? Can I get back next week? And a lot of times you might even Google, how long does it take before I get back to concussion? Well, guess what? There is no answer. So if you ever see it takes this long to come back from a concussion, that's a lie. There is no answer to it. It has everything to do with following that graded return to
There's
activity.
averages, there's
charts.
all the things, but that is a subject of, hundreds of thousands. It doesn't
Exactly.
matter when it's the subject of one. It's the same thing with rehab. Is no two rehabs are the same because no two people are the same.
Exactly.
I'd say twins, but they're different.
Yeah, exactly, right? So if there was a main takeaway, it would be that you cannot rush through a return to sport protocol. You have to allow the science and your body to tell you when you're ready, right? For example, like Alex said, you cannot even do a light aerobic activity until you can go through just your typical day-to-day stuff without getting a headache. If you're getting a headache when you get out of bed and go brush your teeth, you're not practicing, or you should be, right? And if you do, you're going to continue to cause more damage. The key there, if I said earlier, actual blood flow is typically what's needed to increase healing and improve healing with an injured tissue. Within the brain, it's not. And so if you're getting symptoms by the blood flow that happens and the rise in blood pressure that happens when you get up to brush your teeth, you're for sure going to get it when you go do some light aerobic activity, right? Mm-hmm. So once you do that, once you've proven that can happen and that lasted for 24 hours without causing any symptoms, then you can start doing that light aerobic activity. Once you've done that and that's not increasing your symptoms, then you can get into the sport-specific practice, right? You can start to catch and throw and do some things. That has to go through that entire process before you return to sport. If you don't, you are setting yourself up for a long period of problems, right? So, and I can even speak to this personally, right? If you don't handle concussions well when they happen, they can become chronic. They can be things that follow you for a long period of time, okay? And you don't want to do that. And so it's very easy as a high school athlete to say, dude, we got a big game next week. We're playing our rival. Like, I've got to get back. One of the most common places to lie in the sports world is to lie about your symptoms after concussion, right? Because you can. It's very subjective. You just have a trainer asking you,
or lie about your
do you have headaches, right? And you can easily say no, and then the trainer says, cool, let's go. Well, guess what? There's a lot more to that. So I wouldn't just necessarily trust some, an athletic trainer that maybe also has a lot of skin in the game of like, hey, we want to get this back. There's pressure maybe from a coach or different things like that. I think it's good to get opinions, right? I think it's good to get with a sports medicine doctor. I think it's good to get with a physical therapist and have a whole team of people around you to help make sure you do that appropriately. Because, like I said, if you don't handle it appropriately, this could be something that follows you for a long period of time. And the key there is that when you get one concussion, you're more susceptible for others if you don't take care of it, right? And so it's very important that you handle it well.
And I think trust your
soapbox.
Yeah.
Sorry.
And I would say trust your athletic trainers, trust your coaches, trust your parents to have what's best for you. Cade gave the one example of the person who's maybe being leaned on to give the right answer, but truly they care about you. And so not to lie about that, not to have that opportunity, but I think they're also the wait and see. I think we're protruding this image that this takes a long time. I know plenty of people that progress through protocols day to day. So they can go through a 5-stage protocol in 5 days, or even, maybe they're already in stage 3 by the time they walk through my door. So I don't want it to seem like, oh, come to therapy and then it'll take forever in the aspect of this takes time, but the wait and see is not going to work. It's the same thing if you wait and see for your bicep to grow by looking at it and wishful thinking instead of being able to...
It hasn't worked for me.
Unfortunately, sometimes people feel too upset that they don't want to lift that 5-pounder. They want to go straight for 10 or 15 when really starting where you're at. And that's the most important thing with identifying last week, making sure you are seeing the concussion, making sure you are pulling that athlete, making sure you're producing that treatment plan. And then truly, you need to start where you're at and progress. This is where I would say, as a profession, everybody should be doing this, is you should be looking on how to progress. You should be looking on how to get one step closer. There should always be that plan. And that's what I wanted to just take as a take home, is that making sure you do it right the first time. Your initials after somebody's name or the amount of time or years or anything like that are not as important as how up-to-date people are in how to treat concussions, as well as, if we take anything out of today, is that do not wait and see. Do not force through it, I should say. Those are both ends of the spectrum. Respect your body, respect what you're doing with it, because it's a tremendous instrument, and I think also it's one of those temperamental areas of our lives that we don't want to acknowledge until something goes wrong.
Yeah, absolutely. So I love this. Now, Right Physical Therapy, we have 14 clinical locations throughout the Magic Valley, Eastern Idaho, Boise. We have well-trained therapists to be able to help you with concussions. One of the most frequent things we hear is that I had no idea you guys treated concussions. We're here to tell you that we do, and we do it very well. And if you have any issues, please reach out to us to any of our clinical locations. We are happy to help you. Hey, we did it. We made it through.
Didn't acknowledge Tyler's height.
We had a goal to not talk about Tyler's height through the whole entire Facebook Live, but guess what? We just talked about it.
It's okay.
So I guess
I'm
we
still
lost.
proud of us.
We did pretty good.
Still proud of us. That's like a new record.
Yeah, we did talk about it, that he made a grandma joke. We gotta throw a shot at him.
He's
no
got
matter what.
influence.
Yeah. Looks like we have one more question. Let me just check it. So Sarah's just saying she had no idea that you could come to PT for concussions, and it's worked well for her. It's worked well for many people. We're happy to help in any way we can. Rebecca, was there any other questions or anything we missed?
I didn't see any questions,
Okay.
but you might confirm, have them let us know if the closed captioning did not work.
Okay,
I think we're
perfect.
good.
We've had a lot of questions about the closed captioning. It's a process that we're figuring out. Let us know if it did not work. We want to know. We want to be able to help people with that. And so thank you very much for your time today, guys. We will be back next week for more. And thanks for joining the Right Physical Therapy Show.
Thank you,
Hey.
everyone.
Good job.
Good job.